Good morning, students. Today we'll be talking about restorative cement that is called zinc oxide eugenol cement. This cement is used for various purposes in dentistry, and we'll be talking about this, learning about this cement today. So first, let me talk about what are the different objectives of this class. Okay, at the end of this class, you all should be knowing about its availability, its uses, its composition, its manipulation of zinc oxide regional, and what are the setting reaction and what are the properties. So today we'll be discussing this topic under these different sections. Okay. To be very precise, this is one of the oldest restorative or restorative cement that was used in dentistry in 1890s. Since 1890, this cement has been used in dentistry. The advantage of this cement is that it is biocompatible. When I say biocompatible, okay, after the glass enamel, if you look at the biocompatibility of the restorative cements that are available, so after MTA, glass enamel cement, zinc oxide regional takes that place. So it has a very obtundant effect on the exposed pulp. Okay, when I say it has an obtundant effect, that is, has a soothing effect on the pulp. Okay, it's also called as anodyne effect. Okay, obtundant effect is it also helps in healing of the pulp. One of the main disadvantage why this cement has not been used as a restorative material is that because of its low strength. Okay, though it has good biological properties, because of low strength it cannot be used as a permanent restorative cement. So it is used only as a liner, as a pulp capping agent, and as a low strength base it is used. Okay, so today we'll further discuss about the composition of this cement, how it is availability. If you look at the availability of this zinc oxide eugenol cement, it is either available as base paste or catalyst paste. It is also available as powder and liquid. It is normally available in liquid is available in bottle, and the powder is available in a bottle only. But okay, next look at the applications. If you look at the applications, it is used as a temporary and permanent cementation of restoration. A temporary restoration, when I say that the duration of that restoration in the oral cavity is for short period of time. Permanent, it can't be used as permanent cementation of restorations. When I say cementation, it can be used for crowns. Okay, when you have a crown, when you're after your treatment or root canal treatment is done, when you plan to go for placement of crown, you need to lute that. Okay, that luting purpose is done with either different cements are used, of course. In that you can use for temporary purpose you can use zinc phosphate and zinc oxide eugenol. For permanent cementation you use glass enamel cement. There are again in glass enamel cement there are type 1, type 2 and type 3. For example, type 1 is luting. Okay, so type 1 is used for cementation. And also temporary filling base. Okay, when I say temporary filling base, so it is used for short purpose of time. So it is not intended to use as a permanent restoration. It is used as a temporary filling material, especially when multiple caries are involved. So when you remove all the caries, till you decide a permanent restorative material to be placed, you can give zinc oxide eugenol as a temporary filling material, and then it is used only for that short period of time, so it cannot be used as a permanent restorative material. And second, it is used as cavity liner or base. When I say cavity liner or base, it is used in thin consistency as a beneath the permanent restorative material for protection of the pulp. So base is a little more, it is used in more thickness, it has some physical properties, it can bear some strength. That is base, whereas liner is a thin coating on the pulpal floor, so it can be used as a liner or base. And also as a pulp capping agent it can be used. When I say pulp capping agent, either whenever there is an indirect or direct pulp capping, whenever to summarize the pulp capping procedure in small, When I say direct pulp capping, that is there is an exposure of the pulp. Okay, even when we didn't have more biocompatible materials, so in those times zinc oxidizole was used as a pulp capping, direct and indirect pulp capping material. But with the advent of latest materials like MTA, glass enamel cement, biodentin, so we no more use zinc oxidizole as pulp capping agent. We use it only for other purposes mentioned before, like liner and base as a temporary filling material, and also for temporary cementation of restorations. Okay. And also its use is used as root canal sealer. So one of the most commonly used sealer is zinc oxide based sealer. When I say root canal sealer, it is used for coating the gutta percha with the sealer and obturation of the root canal treatment. So it is used during root canal treatment. So let us come to the classification of zinc oxidizole. So we basically classified it into 4 types: type 1, type 2, type 3 and type 4. This classification is based on the powder liquid ratio. So type 1 is used for temporary cementation. Temporary cementation, which I have already said before, that it the crowns will be removed, so it is not for permanent cementation. So temporary cementation it is used. Second is permanent cementation. So type 2 zinc oxide eugenol is used for permanent cementation. Type 3 is used for temporary fillings and thermal bases, and type 4 is for cavity liners. Okay, we have some modifications of zinc oxide eugenol also, that is ethoxybenzoic acid reinforced cement, resin reinforced cement. Okay, apart from zinc oxide eugenol cement. Okay, there are certain modifications. The same zinc oxide eugenol cement is modified either with the added of resin, it has become resin modified. With the adding of ethoxybenzoic acid, it has become EBA modified, ethoxybenzoic acid aluminum or reinforced cement. So this picture what you see is a temporary cement that can be used. Okay, the main purposes which we have discussed earlier, that it can be used as a base and a liner. So when I say base, it is used on the pulper floor and the axial wall, and liner is used as a sub base. So these both are used for to promote the dentin, for formation of reparative dentin. It is used, zinc oxide eugenol is used. Now let us come to the composition. So as we already discussed that it is available in powder and liquid. So the powder contains zinc oxide, which is a main primary ingredient in that. Then you have zinc acetate 1 to 5%. The function of zinc acetate is accelerator. Then you have liquid. The liquid is contains the main chief ingredient is eugenol. So eugenol, even your you have even olive oil also. And eugenol, normally you have clove. From clove only you can even have eugenol in that. So it has, as I told you, it has anodyne or obtundent effect. So for patients who are having acute pain, people in olden days, they nowadays also they place one clove into the cavity or in the oral cavity to alleviate that pain. So you can understand that that effect of alleviating pain is because of eugenol. And olive oil is added to control viscosity. Okay. unconsumed eugenol can irritate the pulp. Okay, so the pH is neutral. So when you have an zinc phosphate, when you take zinc phosphate liquid, the phosphoric acid liquid pH is around 1.7. So this is very acidic. Whereas with zinc oxygenol, the pH is 7. It is neutral. So it is not very irritant to the pulp. So it can be used in deep cavities without harming the dental pulp. So only eugenol without addition of powder can be an irritant. So eugenol is also bactericidal. It helps to minimize the effects of bacterial ingress and production of exotoxins. So it is bactericidal. It kills the bacteria, and also it causes less damage. Whenever there is micro leakage, it damages the pulp. Solubility: the said cement is highest among the cements. It can, so that because of its solubility, it cannot be used as a permanent luting cement. Hydrolysis and disintegration of the cement structure occurs when it comes in contact with water. So before it sets, when it comes in contact with water, there is dissolution is very high. Coming to the effects of filling and filling materials. So whenever, what is the important factor for us to remember here is that eugenol affects the polymerization of composites, and also it affects filling. So you are not supposed to use zinc oxide eugenol when you want to use composite as a permanent restorative material. So because it interferes with the polymerization process. So that is the reason you should be careful when you are planning to use composite as permanent restorative material. Then coming to the thermal properties. So coming to the thermal properties, the thermal diffusivity is similar to that of dentin. So it can act as effective barrier under metallic restoration. It has an effective insulating properties also. One disadvantage with this cement or less usage of zinc oxide eugenol in multiple areas is that it doesn't have the addition to enamel and dentin. So that's why it cannot be used in final cementation of grounds and bridges. So when you come to the manipulation, you have powder and liquid. You need a mixing pad and a spatula. So if you look at that, in the first there is dispensed in two-phase system, and then you have powder liquid system also. You take equal quantities of powder and liquid, and then you use a stainless steel spatula. Use the broad area of the spatula and mix it to achieve a uniform consistency. So in two increments you use the powder and liquid, and you achieve this consistency. So the powder liquid ratio that is used is 3 or 4:1. So 3 parts of powder to 1 part of liquid. Okay, this is how the powder is mixed. So since the strength of zinc oxide is less, it is reinforced with ethoxybenzoic acid to retain its strength. This is used as a cavity liner and luting agent. This polymer then is again reinforced with resin. It is called polymer reinforced zinc oxide eugenol cement. Because of good strength and improves abrasion resistance and increased toughness. It is used as a luting agent, as a base, liner, and temporary filling materials. It can also be used as a periodontal co-pack. It is called zinc oxide eugenol, also used in periodontal purpose.